If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Hey, good evening, everybody. Hello. Welcome to another episode of Talking with Dr. Donna. As you know, you have an appointment every Thursday at 6:30 p.m. with the doctor. So thank you for keeping your appointment. This is your first time joining here on Talking with Dr. Donna. I am your host, Dr. Donna White Carey, and I thank you for joining. If you have already seen my show, welcome back. As usual, I'm going to do a couple of housekeeping things here. If you have not already subscribed to my show, I really appreciate it if you go over to YouTube. If you're watching on Facebook, go over to YouTube. If you're on YouTube, go ahead and hit that nice big red sign that says subscribe. Hit it and then hit that bell icon right next to it so that you know every single time we go live. And we go live when? Every Thursday at 6:30 p.m. As you know, on our show, we have a goal and we have a mission. And what we are attempting to do is to build generational health. We're looking at our 4 pillars of health to make sure that we focus in on our spiritual pillar. We focus in on our mental and emotional pillar of health. We pay attention, of course, to our physical health and also looking at our environmental health. I firmly believe that if we look at each of these 4 pillars within each and every generation, we are going to end the cycle of premature death in our community. And that's our mission. That's our goal. That's what we are working towards. That's why we are here every single Thursday, not just to show up and have somewhere to go and something to do, but for the purpose of ending premature death in our community. So we're going to talk a lot about, oh, that's a nice slide. Thank you. We're going to talk tonight really quickly about some of the things that you need to know, what's going on and happening in our community and in our world right now. So tonight is really going to be Dr. Donna's Need to Know, what you need to know. As always, we are live, and so if you have a question, please feel free to leave it in the chat, and we will try to get to your question and answer your questions tonight, okay? So our need to know, what we're going to start with tonight. Number 1, let's talk about COVID. We're still in a pandemic, and I want to talk to you a little bit tonight about where we are in this pandemic. I know that we have been relaxing lots of different mandates and requirements, and so you might be lulled into thinking that this pandemic is over. There's nothing else I need to do. We're not quite there yet. So our cases across the United States, our cases are starting to have a little bit of a bump. We're also starting to see our death rates are kind of steady. About 375 people are dying a day. Now you might think, wow, that's really down from the 2,500 people that we had dying in the peak of our pandemic. True, but that's still 375 people who are losing their life to this virus every single day on average. So that's nothing to just sneeze about and nothing to just say, oh, well, we don't need to worry about it. Our hospitalization rates are steady. And when we look at what it is that is infecting us, that's the map that you're looking at right now. That's the map of the United States. And it's looking at which of our variants is causing the most infections. So you'll see light pink, you see kind of a purple and you see kind of a red. Those are the different variants that are out there that are causing infections. Right now, that hot pink or pale pink, I guess, pink variant that you're seeing that's out there is that subvariant of Omicron. So remember way back when we had the Delta variant, and the Delta variant was all over the place and everyone talked about Delta variant. Then we had the Omicron variant, and then after the Omicron variant, which was BA.1, right? You have to give it a name. Then the subvariant of Omicron became the most dominant, and that's what's out there now. The question is whether or not this subvariant that we're seeing, is it more dangerous, right? That was the question in the beginning. That's always the question whenever we have a variant that comes out. Is it more dangerous? Is it going to make people sicker? Is it more contagious? The point is that it's there and it's causing infection. Right now, we know that it is the BA.2 or the subvariant of the Omicron, BA.2, that's causing the dominant infections. And so what does that mean for you? What does that mean as we're starting to lift and end mask mandates, as we're opening up, we're saying you can come back? What does it mean that we have these variants that are still out there? We're still having people who are dying every day from this virus. What does it mean for you and I? So let's talk about the number 2 thing that we're going to discuss tonight, and that is masking. Because they go hand in hand, right? Knowing what our variants are, knowing our risk of infection, and then going to what do we do to sort of decrease our risk of infection? What are we doing to help to protect yourselves and your families? So the mask mandate, I want to talk a little bit about masks, because one of the things that we know for certain when we were looking at how do we keep ourselves safe is looking at masks, right? We had masking, we had hand washing, we had distancing. And now mask was sort of like the last thing that we had that was left to kind of put in place to help you prevent infection while you're in the public setting. Well, as you know, on the 18th of April this month, not too many days ago, the federal judge struck down the mask mandate, calling it illegal, saying that the federal government, the CDC, overstepped their authority in being able to enforce and make people wear masks. Okay, fine and dandy. Judge says it's not gonna, you overstep CDC, but what does that mean for you? And so we've talked a lot about masking and the type of mask to use, and I did a show a few months ago about the 2 most important things that you want to pay attention to in your mask. Number 1 is the fit of your mask, and number 2 is the filtration of your mask. And so there are N95 masks, the KN95 masks, we have surgical masks, and we a long time ago said do away with the cloth mask. So they're not even up there. So if you're still wearing a cloth mask, you're like way off. Throw it away. You might as well just not wear it. I'm saying that you should still wear a mask. Why? For the reasons that I just listed about looking at the number of cases and how the virus is still out there and still causing different variants to occur. So I'm saying I still want you to wear a mask, okay? Which mask should you wear? So an N95 mask means the filtration, it filters out 95% of the particles. Great, 95% of the particles are going to be filtered out. That's what we want, right? Surgical mask is going to filter out, it's somewhere around 80% effective in terms of preventing spread of the virus. So when you're thinking about whether or not you personally are going to continue to wear a mask, I want you to think about this. And let's go to the next slide where we're showing some rates of infection, right? And how long does it take for you to really maybe transmit COVID from one person to another when you are without a mask? So the majority of this country, it's okay for them to go without a mask. They don't have the comorbidities that the African American communities have. They may not be battling age or immunocompromise. For people who want to take that risk, I say more power to you. But for me, I'm going to continue to wear my mask. And why? Because it is protective, okay? So this slide kind of shows if you're not wearing a mask and the person next to you is not wearing a mask, how protective are these different types of masks? And like I said, so there's a column there that says cloth mask. Like I said, I certainly hope you're not still wearing a cloth mask. So let's just not even look at that category. Let's look at surgical masks. So if you're wearing a surgical mask and the other people around you are not wearing a mask at all, that if you're in a closed room or close proximity and that person who's not wearing a mask has COVID, that you have, and these are estimates. This is not saying you're going to sit there, set your timer on your clock, and then say, oh, it's 29 minutes and 30 seconds. I can get up and I'm still going to be fine. No, these are estimates. But you have about 30 minutes. And if you are wearing an N95 mask, you have a couple of hours. So you can see that the type of mask that you're wearing really does mean something. It really does. It really does say if it is protecting you and if it protects you in a little bit better. So as you're out and about and you're in restaurants and you're driving and you're in cars, right? We know in planes and trains, no longer do people have to wear a mask, that you have some time, if there is someone around you who is infected with coronavirus, to still be protected. And that is if you are protected, which is why I'm still recommending that you wear a mask when you are out in public, when you are on public transportation. I recommend that you wear a mask. And if you're traveling, like on a plane or a train, or if you're taking the BART train because you're going into work, then I recommend that you try to get as much of a filtration mask as possible, like an N95, to wear when you are out in public transit. The other thing is looking at what we know about vaccines and being masked and being vaccinated or unvaccinated, okay? So there's a slide there that looks at our cases, okay? The main thing that I want you to get out of this slide, the numbers are probably too hard for you to read, but you can see these colors, I hope, is that for those people who do not have their vaccine, and when I say vaccine, I do mean vaccine, your primary doses, as well as your booster, okay? We know that the boosters are lasting somewhere between 4 and 6 months for their peak efficacy. So working the best somewhere between 4 and 6 months. And when you have your primary series, your 2-dose shots of Pfizer or Moderna, plus a booster, then it protects you from getting this virus. So if you put on your mask and you're vaccinated, you really are giving yourself a great opportunity to prevent infection. Those people who are not vaccinated, we're seeing that they have almost a 2 to 3 times higher rate of getting the virus than people who have the vaccine, okay? So, do the vaccines work 100% of the time? No. But are they going to protect you from serious disease and hospitalizations? Yes. And we've talked about this over and over, but I felt like it was worth repeating tonight because the world is telling us that we can relax. And I'm saying you can relax to a point, but for your own personal safety, I recommend that you continue to wear your mask and that you make sure that you get boosters. So there's a current recommendation in our county of Alameda County that if you are over the age of 50 or if you are immunocompromised, that you are now up for a booster. There are booster shots that are going to be coming for our kids ages 5 to 11 Pfizer has already said that it's done. It shows that it works. It shows that it increases the antibody response. And so we can probably expect to see the booster shot for 5 to 11-year-olds sometime this summer, which is great. But when we get the data, I'll let you know what to do. But for right now, I'm saying make sure that you are up to date on your booster shot and continue to wear a mask. All right, I'm going to stop and pause and see if there's any questions in the chat right now. And if you have a question, remember, put it in the chat. Or if you wanted to say hi to me, hi everyone out there, go ahead and say hi, put it in the chat, and let's see if there's any questions. Any questions out there yet?
Yeah, somebody asked, is the new subvariant the Omicron Delta combination?
So there is a new variant that is out there, and that variant is called the XE, right, which is a combination of the Omicron variant and the old Delta variant. And yes, that variant is present. Is it causing a majority of infections? No. That is still the subvariant of Omicron that is causing the majority of our infections. Is that it? Okay, so if you have any questions, put it there. All right, so my final need to know that I want to talk about tonight is misinformation. Anybody and everybody out there can put up a video, can have a conversation that goes viral about what's going on around this pandemic. And I've said from the very beginning of this pandemic and the handling of the pandemic that it hasn't all been about science. We know that. We know that it has been politically charged, and we know that economics has played a part in it. And so because there's science, there's a little bit of economics and a little bit of politics, there's a lot of confusion out there. What do you do? Who do you listen to? Who can you trust? And so tonight because as we are likely going to see more variants, as we are likely going to have an uptick in cases again, I don't think it's going to get to that point where we were at the beginning of the year, but we know that we're going to probably have an uptick. It's going to be important for you to know who you should listen to. There's doctors talking, scientists talking, the federal government's talking, the CDC says something, the FDA says something, public health departments say something. Some mandate is coming from the federal government and the state says, no, we're not gonna follow that, or we're not gonna end that ban. It's very, very confusing. And I wanted to just acknowledge that tonight. And this is why it is so important for you to identify people that you trust, who are knowledgeable, understand the information, and who can feed that information back to you. I hope that during this pandemic, I have become someone that you can trust to bring you information that's accurate, to bring you information that's up to date. But there's also other people out there that you can listen to as well. My colleagues, Dr. Kim Rhodes and Dr. Noha Abalada, are also providing information on a regular basis about this pandemic. And so I want you to first to identify who is it that you've trusted during this pandemic? Who has been giving you good, accurate information? If it's somebody who just pops up out of nowhere and has this viral video, does that mean that you need to trust that person just because their video now has thousands and thousands of views? No, because you know that you can get views just by being controversial, or by saying things that are false, but people are sending it around saying, did you hear this? Did you see this? And you're racking up views because of false information. So the first thing that I want you to do is to make sure that you're listening to somebody that you trust, that you know has your best interest at heart, and then you can make decisions for yourself. I want you to ask yourself, is the information that this person is telling me sort of compatible with what I'm hearing from other knowledgeable and respected people? Can they back it up with credible sources? Can they say that this is coming from a study, or that this is coming from information given by the CDC or by the FDA? Can you back it up? Or is this just some conspiracy theory that I decided I'm going to trust and believe, and now I'm going to create a video and throw it out there? Doesn't make common sense. I mean, so many different things in this pandemic and about the virus and about our masking and the use of the mask, and it doesn't make sense. When you think about it, it just doesn't make sense. How are we putting a tracking device in your dose of vaccine? How in the world are we causing more harm than good by wearing a mask? It doesn't make sense. So I want you to ask yourself, is this information coming from a trusted person? Is it what I'm hearing from other trusted people? Is it in line with that? Is it coming, can they back it up with credible sources? And does it make common sense? I want you to ask yourself those questions when you're seeing videos, listening to other people out there, because it is very confusing. And there is a lot of information that is contradictory, but there are very clear reasons why you should trust some people and you should not trust others. So hopefully you will continue to watch this show to get information that is accurate and trustworthy. Any questions coming from the chat?
No questions.
All right. All right, so that ends my need to knows for tonight. As you know, here on Talking with Dr. Donna, we always have a food of the month. And this month, our food of the month is nuts. Yay! I know you like nuts. I love nuts. I love almonds. I love pistachios. I love cashews. I'm not a big fan of peanuts. But I'll eat them if it's in a trail mix type thing. So why did we choose nuts? Because there's lots of health benefits to eating these nuts, right? So some of the health benefits of the nuts are they're a great source of nutrients, right? Antioxidants, they help with weight loss. They can lower your cholesterol, right? Which is really good. That's why they're heart healthy. Lowering your cholesterol, lowering your triglyceride levels. They can reduce inflammation. And inflammation in your body overall causes disease. It can cause heart disease. It can cause asthma. It does lots of things when you have inflammation in your body. It's also very beneficial in fiber. And like I said, will help to reduce your risk of heart attack and stroke. So last week we talked about a couple of nuts we wanted you to try. We talked about pistachios. And this week we're going to encourage you to think about trying some almonds. Okay? So anything different about almonds versus some of the other benefits? And one of the things that I like about almonds is that it is also high in vitamin E, and it can help to regulate your blood sugar. It's really important your blood sugar doesn't go up and down. And when you have a steady state of blood sugar, that keeps your body happy. Like you want a happy body, right? And of course, it continues to do all the other benefits of the other nuts that we talked about. So this week, I really want you to try to put some almonds in your diet and continue to incorporate other types of nuts. Now, if you are doing something, have a great recipe, you're using it in a different way, please post to my Instagram or Facebook and let us know how you're eating your nuts this month. I've been crushing it into my yogurt in the morning because it adds a little bit of protein on top of my yogurt, so it keeps me full. I always add almonds on my salads, and just really think about, sometimes you can just have a handful in the afternoon to kind of help to curb your hunger and again, help to maintain your blood sugar. So let me know how you're eating your nuts this week. Okay, there's a question I see in the chat.
Yes, Sharice wants to know why her doctor recommended that she get the Moderna vaccination or the Moderna booster after the Pfizer.
So the question is, why, if you got your Pfizer vaccine for the first 2 doses, would you then be recommended to get the Moderna for your booster and not
It was the opposite way around. Sorry. It was she got Moderna, and then her doctor recommended for her to get the Pfizer.
Yes, so it works either way. It works with using the Pfizer. You got 2 doses of Pfizer, and then you got the Moderna, or the 2 doses of Moderna, and then you got the Pfizer. So what they found in some of the studies was that in the mRNA vaccines, right, which are the Pfizer and the Moderna vaccines, that if you use the other mRNA vaccine as your booster, it gave you just a little bit of a higher bump in your antibody response. And so a lot of people recommended going with 2 doses of one mRNA vaccine and then the other vaccine for your booster. So that's why your doctor recommended that way. Any other questions?
No.
No? All right. Well, again, thank you so much for watching this episode of Talking with Dr. Donna. I know it probably seemed like it wasn't a whole lot of new information, but it was information that I wanted to make sure that you're aware of and understand, because we are still needing to protect ourselves and our loved ones. And with all of this information out there that is often extremely confusing, I wanted you to know what I recommend and what I want you to consider when you are out in public. Continue to wear your mask. Continue to, of course, wash hands, keep your hand sanitizers with you, and try to maintain some distance, even though we're now crowding back into smaller spaces. Try to maintain your distance, because all of those things worked to help keep you safe in the first place, so they will continue to work to keep you safe now. All right? So thank you for watching. Again, if you learned anything today or heard anything that was good for you and that you appreciated, I appreciate if you would subscribe to my channel, share this with someone else, and make sure that you recognize that your health matters. And our generational health network, we need you to continue to be a part of it. So thank you for watching this show. And until next Thursday, take care, and I hope you keep your appointment next week. If you have a question for Dr. Donna, please do leave it on my page, and I will be happy to answer the question for you.